and welcome to my channel. I'm Machine. I've been in the healthcare field for a long time. I want to say like close to 6 years. And I have developed a generator, a nursing tool, so to speak, to kind of, help out nurses take the load off, so to speak. My sister-in-law is a registered nurse. She's been one for like, I want to say close to 14 years. My husband just finished his nursing school. He's been an LPN for a year. And one of the things, it was very brutal. Who knows healthcare, who knows nursing, knows that it's no joke. One of the things that stood out to me was how case scenarios, pharmacology, those things, I don't feel like nurses have a lot of time, to learn all that. And it's just so much. So I sat down and I pretty much, every time he came with a complaint, I would write them down and, I would do my research and look what other nurses were, stressed about. And I developed this tool, it's a healthcare generator hub, and I developed this tool to help nurses, and it's not just nurses. Primarily right now, it's for LPNs, RNs, and medical assistants. I was a medical assistant myself. I started out as a HHA and just worked my way through the healthcare field, basically. I've worked in ICU. I've worked in med surge. I've worked in pediatrics. I've worked in OBGYN. The only specialty that I haven't worked in is oncology, and briefly psych, but not fully psych. So, with a little bit of my healthcare knowledge and, putting together this tool, I basically tried to implement some of the things, and I hope you guys find this helpful. If you know a nurse or RN or an MA, anybody that's going into nursing school, that's in nursing school, that needs help, or, thinking about going to nursing school, you can refer this video to them. You could just, hopefully this helps someone. Let me know in the comments. Now let's get into what this video is all about. So this is the tool that I developed. It's a generator. And basically with this generator, you have study guides and you tailor it down to, in the generator, I have LPN, RN, MA, and I have physician's assistant. So when you, in the study guide category for an LPN, this is basically, it narrows it down to what you need to study for based off of your title. And as we go to the drop down, you'll see what an MA should study, what an RN should study, and it gives you all those fields with that, right? And that's the study guide section. Now, if we move over to specialties, now again, ICU, pediatric, med surg, ER, and psych. Those are the main floors. When you hear anybody talk about nursing, it's pretty much those floors. And it gives you, if you reset this, how I tailored it is that when you click on ICU, you have an option to pick, are you an LPN, RN, MA, or physician's assistant? So let's just pick LPN, and it's going to give you the duties of an LPN in an ICU unit, the duties of an RN in an ICU unit, and so forth, right? And then pediatrics is the same thing. It's going to give you what your duties are. As you go along, you see that the duty changes by the title. Med surge, it's going to give you the same. You have a reset button, you can reset. ER, it's going to give you the same thing. Psych, it's going to give you the same, right? And that was the specialties button. Now come over here, you have the drug reference button, and this is like pharmacology. You have drop down, and these are basically 10 medications that you prescribe on a daily basis, right? And say you click on lisinopril, it's going to give you this, the generic name, right? It's going to give you what it's the uses, and then it's going to give you the side effects. Say you click on tramadol, right? Pain relief, side effects. So you have 10 drugs in here, and basically, you all know Tylenol. And the more you click on it, different drugs, it's going to give you basically side effects, what it's used for, and, the generic version, Zoloft, and then the generic version is sertraline, right? And then it's for depression, and then nausea is the side effect of that drug. And, as aspirin, aspirin is for pain and clot prevention. Of course, side effects are bleeding. Metformin is for type 2 diabetes, GI upset, basically. As you click through, amoxicillin is antibiotic, infection, side effects is rashes, stuff like that. So if this gives you a detailed, basically this is just like a stepping stone to getting yourself wet. If you just quickly want something and you're like, what is this? I don't remember what this drug is again. This is the tool to use. Now, if you want to go more in depth in nursing, this is a generator. So what I also did was I included a GPT with the generator. So if you want more in-depth nursing help, then you just need to go here and you click on GPT guide, and it's going to say, this is the name of the GPT that I developed with the nursing. When you click here, it's going to open up your Chat GPT. I created this in Chat GPT. This is the name of the nursing tool. These go hand in hand. The generator and the GPT goes together. Now the generator, again, it's really short. It's very simple. If you want more help, again, you click the button. It takes you automatically to the GPT. And this is what the GPT looks like. Now I have study guides and flashcards, skills checklists, specialty, case scenarios, drug medication. Now, if you click on drugs and medication, it's going to ask you, I tailored it to ask you specifically, are you an LPN, are you an RN, or are you a medical assistant? That way, whatever you tell your GPT, that's what it's going to give you, only tailored to your field. So if you say this, I am an RN, give me most common, right? Used drugs. And then it's going to tailor it to you, and it's going to give you the commonly used drugs. And it's going to do the same thing that the generator was doing, right? But the only difference is you're going to get more drugs, right? So as you can see, this is the most common uses. The class, it gives you the drug, the generic brand, the class of the drug, the use of it, the side effects, and the nursing considerations, right? You know that the nursing considerations is important because you need to know what to do if you give a patient furosemide, which is Lasix, right? You need to know that you have to monitor the I&O daily, the weight, assess the blood pressure, and fall risk, right? Those, most people, I'm not saying that not everybody, but sometimes we nurses forget that. Sometimes the nurses forget that. And lisinopril. So it basically, these are all warfarin, anticoagulant, right? DVT, PE, monitor INR. This is what it tells you, right? Insulin. These are metformin, digoxin, Zoloft, morphine. These are the most common used medications that you're going to come across in your nursing career, right? And this is a more in-depth look of what you get. And basically, for an LPN, let's say you narrow it down to LPN, right? So as an LPN, these are what you prescribe as well. It's the same thing, basically, as the RN would do. But as you can tell, the LPN is a little limited, right? If you notice, the RN has tons of drugs in here, and the LPN just has maybe like a few, but still, right? And it gives you a tip. Always check vitals and labs before giving meds, BP, heart rate, blood sugar, and all of that, right? So basically you have all of this, and this is just all pharmacology. Now, again, for medical assistant, say for example, you want to know, and or medication is, we don't really give a lot, but basically the common usage and stuff, we do give some of these. We don't adjust dosage. It tells you we don't adjust dosage or interpret labs, focus on patient intake, documentation, education, and alerting the provider to red flags. Basically tells you. So if you want to get into MA school and you're like, what am I going to prescribe? What am I going to do? This is, you could look this up, and this is how this GPT is helpful. Now, the next thing that it gives you is skills assessment, right? So you're going to tell it, I am an RN. Give me skills assessment. And it's going to give you a skill assessment checklist, right? Basically, this is what an RN will do. Patient assessment, right? Patient medication administration, 5 rights. Then it's going to give you IV therapy and lines, wound care procedures, critical thinking, documentation, very key. Documentation in nursing is important. Patient education. And it's going to give you a tip. And then it's going to ask you if you want to build a full competency checklist, right? Now, LPN. Let's switch, and it's going to give you an LPN checklist. You don't even have to type it in again. It pretty much knows what you already want, unless you change gears. But once you stay on the same thing, it's going to give you what you want. So LPN checklist, right? Basic patient assessment, right? Administer medication, wound care, patient care, critical thinking and reporting, documentation, right? Patient education within scope. See, it tells you that, it gives you specific. And the tip is always check assessments. You see how whenever it highlights in school, they teach you, whenever a teacher highlights something, it's important and need to know. That's the same thing with this GPT. If you notice, what you need to know is highlighted in bold. So if it's highlighted, you need to know it and pay attention to it, right? So going forward, going down, let's do an MA skills assessment. Now, if you notice on the generator, I had a PA on there. I did not add physician assistant or nurse practitioner to the GPT. But if you guys know somebody that is in a PA or in nursing school or in an NP school, and you feel like, you know what, I feel like this would be a good asset, you let me know, and then I could implement it in there, and then I could just send you guys the free updated version so they could try it as well. Or you could refer them to that video, and I will do a next video on that, going through what a PA and NP does, like how we did this video today. Now, again, it's going to give you what an MA skills assessment is like. Vitals, procedures, patient care, infection control, documentation, administrative. And see, it tells you the NHA. Now, if you notice, the NHA is what an MA takes to become a certified medical assistant. We need license for that. And NCLEX is basically what a nurse and LPN will take to get their license. Okay, so it gives you step by step all of that. So what did we cover so far? We covered pharmacology, and then we covered skills assessment. Now it doesn't stop there, guys. It gets better. Now, scenarios, case scenarios are key. Again, I feel like, nurses are not prepared so much for, but then again, I say this, my nurses might disagree with me, it's just my opinion. Nursing is 90% critical thinking, and the other 10% is just getting through school. Because what they prepare you for in school, when you get to the real world, half that shit is not even gonna fly. Because you're gonna have times when you're like, they didn't teach me this in school. What the hell am I doing? Emergency situations basically just throws you in there, and you got to think off the bat. You got to think off the top of your head. But basically, at least you know. So it's gonna tell you, okay, let's say this. I am, right? Sorry guys, it's hard to video and hold the phone. I hope you guys can see. I am an RN. Give me 10 case scenarios, right? If I could spell. But basically, it's going to generate 10 case scenarios that an RN would handle, right? Post-op patient, diabetic crisis, cardiac monitor, pediatric fever, blood transfusion, stroke patient, COPD patient, right? Surgical wound patient, chest pain, sepsis. All these are things that you possibly see on if you want it breakdown by unit. Let's do a pop quiz real quick. So let's test my knowledge. So post-op patient, I would say same day surgery or surgery. Diabetic, I would say it could be ER, ICU. No, it could be ER, and med surge. Cardiac, CV tele. Pediatric, of course, peds. Blood transfusion, it could be ER, it could be med surge, it could be ICU, right? It could be possibly oncology, hematology, same day surgery, whichever one of those specialties. You never know who might need a blood transfusion, where, right? So let's basically say all specialties at this point. Stroke patient, again, it could be anywhere. COPD, I feel like it could be ER, med surge, could be ICU. It depends. Surgical wound, it could be anywhere. But again, it gives you chest pain, cardiology, CV tele, possibly med surge. Sepsis could be ER, could be med surge, either way. But again, you guys get the gist of it. It's gonna give you the case scenarios, right? And it's gonna tell you based on your RN scope what your case scenarios is. Let's do an LPN case scenario so you guys can get a side-by-side comparison of what an LPN would look like. So LPN case studies, right? Again, this is LPN. So hypertension, hypoglycemia, wound care, management, IV site, catheter, right? It gives you the answers too, if you guys see that. Chest pain, tube feeding, post-surgery. So if you notice, the LPN and RN's case scenarios are totally different. Now, from a standpoint, that's basically what it is. Now, this is just what you're telling it to give you. Now, say for example, you're doing schoolwork or you're studying, and you came across a patient that I am an RN. Let's just say this. I'm an RN in the ER, right? Patient comes in with let's just say, I don't know, head wound. What do I do? Right? Say you're in clinicals one day and this happens to you. You want to know what you're going to do, right? As an RN, ER assessment, see, it's going to give you what your priorities are, right? It's going to give you your neurological assessment, control and protect the wound, monitor. It's going to basically tell you step by step what you're supposed to do. Treat every head wound as a possible trauma. You see it's highlighted there. Until proven otherwise. Watch closely for newer changes. Even a small wound can make a serious intracranial bleed. ABC. Say you're like, okay, I get all that, right? Now, what test do I order? Say you don't know that, right? You're going to ask, what test do I order? And it's going to break it down and give you what tests you should order if you're in an ER, right? Imaging, CT scan, labs is going to tell you the labs that you need. It's going to tell you other tests that you might need to order. And it's going to tell you to do a trauma workup, right? So basically, again, it's going to tell you all of this. Now, for blood work, you see, it tells you a CBC. Now, they might have changed the tubes, which I've never really, it depends. I've never seen a nurse draw blood. But again, this section might be for the MA, right? Or you might do it through an IV. You probably can get it through an IV if they have access. That way you don't need to do that. But CBC is usually a lavender tube. BMP is usually a red top to speckle top tube. And those two, so you draw a speckle top, and by MAs, correct me if I'm wrong, but if my analogy is, it's a lavender tube, I know CBC, and then a BMP is probably, I want to say, a speckle top. I don't know if you draw yellow tops anymore for that, but again, say for example, perfect example, let's do this. Say you don't know what tube colors you're going to draw, right? So let's go to our friend here, and we're going to say for the labs, right? What color tubes do I use to draw? Right? Say you don't know as an RN, LPN, whatever, and you don't know the tubes, right? So here you go. Now it's going to tell you when you're drawing blood work as an ER, in the ER as a trauma, on a trauma patient, possibly. CBC, see, I was right. Lavender tube. And BMP, you draw, exactly. You draw a green top tube or a tiger tube, which is an SST tube. That's what we call it. And coagulation, is a light blue. Cross matches a pink top tube. And it tells you gray top. It tells you the tubes and the order of draws. Look at that. And RNs, you could take note of this so you don't have to bother MAs. I'm just playing. When you don't know something. See, it's going to tell you what it basically does. Right? So this tool has so much information, and it's packed with a lot of resources for you. You don't have to sit there anymore and scratch your head and be like, wait, what is this? If you don't, this is pharmacology. So we got case scenarios, right? We have case scenarios based on, we have medication, we have case scenarios, we have, we put our own case scenarios in it, as you guys see. We got a response. We have tubes, lab work, what you collect, what you do, right? And now, say for example, anatomy and physiology. Now, here's the best thing, guys. Let's generate an image within it, right? Give me an image, right, of the body. demonstrate for, right, anatomy. So, for example, you want a image. You're doing anatomy and physiology and you don't remember the body systems or the functions or whatever the heck it is. Then you could also tell it to, hey, I don't remember what this is. Where is the tibia again? Where is the all of that stuff, right? Just throwing it out there. You could tell it to give you an image, and let's see what it generates to show you, okay, this is what it is, to help you study. And the bad thing with this, with ChatGPT, is it does take a long time to generate your images. But again, I just wanted to show you guys just how much this tool, exactly, it's not just the bare minimum. It's so much. I put a lot of consideration into this tool when I was making it. So I just don't want it to give you, I didn't want it to give you the bare minimum, right? I wanted it to give you a full scope of basically everything, just to make nursing a lot easier. I'm not going to say make it easier, because you're still going to have obstacles because it's nursing, right? But at least to alleviate is the word I'm looking for, a little bit of the stress that comes with this, right? So we generated a basic image. Of course, your prompt could be a lot more detailed, but just for the sake of demonstration. So of course you see here, it gives you just the basic anatomy, the brain, the lungs, the heart, the pancreas, large intestine, so forth, small intestine, basically. And I think this is a little off. It seems like it's a little off. Or am I bugging? But, okay. You guys let me know what you found wrong with this picture in the comments. But basically, anatomy and physiology. And then say, for example, you want a study guide, right? Give me a study guide for AMP, right? And then it's going to generate you a study guide for anatomy and physiology, short AMP. See, it knows what you mean. And of course, see, it's going to generate all of this. So it's going to tell you, basically, it's going to give you a study guide, what you need, the body planes, the physical points, all of this. You get a whole study guide. If you want, you can turn it into a flashcard, Q&A, to memorize it, right? You could do that. Now, again, say, for example, we went through the skills checklist. Did we go through a skills checklist on here? I feel like we did. I don't believe did we? Yes, we did. So we already did a checklist. Okay, we already did the scenarios. Now, NCLEX, which is the biggest thing. Now you could tell it, give me need to know for RN NCLEX. You could also tell it to give you a, what is it called? You can also tell it to give you guide for NCLEX, or give you 10 practice questions for NCLEX, right? And see, it's going to give you what you need to know to study for your NCLEX, right? Safety, infection control, what labs you need to look for, right? Pharmacology, of course, again, pharmacology is the huge problem. This is why, if you notice, I might make this a little biased with pharmacology, but I know pharmacology is a struggle for nursing students. So basically, these heparin, warfarin, opiates, you're going to see these so much, it's not even funny. You're going to have to memorize them, right? So OB, if you work in pediatrics, it's going to tell you everything that's on the NCLEX. Basically like a cheat sheet, right? So as you see that here, and you can say, give me 10, right, practice questions. If I can spell. And just like that, you have practice questions and you have the answers. A patient with COPD admitted with shortness of breath. Which intervention should an RN do first? Of course, it has LPN as well. It has NCLEX PN questions. So don't just think that it's just tailored to RN. No, it's LPN too, right? So here are your practice questions. Again, this was tailored. I hope this helps someone. If you know anybody in nursing school, or you are going in nursing school, or you are in nursing school, let me know if you think that this tool could help you. Comment below. Let me know what you think. Comment below. Let me know what nursing school you're going to. I will drop the link below after, if you guys find it helpful, and just comment link in the comment section, and I will drop the link below to this. And this is the version, because I made 2 versions. This is the free version that you guys can try, and you get 10, just take it for a trial, because you get 10 practice questions, I think, and you get 3 side effects. Everything that we just went through in the full version is in the light version, but just this is the demo version. So, you guys check it out. Let me know what you think. Again, I hope this helped someone. And for all those that are in nursing school, going to nursing school, thank you guys so much. Nurses, you guys do so much. And this is why I'm very passionate about this creation, because I feel like it can help a lot of people. And I hope it helps you, or even alleviate some of the stress that you might be going through in nursing school. And if you have ChatGPT, right, when you just go on your GPT, you're going to go to this tab, you're going to go to Explore, and then you're going to type it in, Healthcare Survival Guide, right? So once you do that, it's going to come up. If you type in healthcare, it won't come up, because you'll get all of this. Basically, you'll get all this, and these are not mine. But my GPT is the only GPT that has this name. So when you type in healthcare survival, that's what comes up. As you can see, mine is the only one that comes up there. So again, I want to thank you guys, and I hope this video tutorial helped you and give you the strength to keep going in nursing school. And let me know what you think about this tool. Thank you so much for watching. Stay tuned for more videos.